and Milestones in Biomedical Research.
Good morning, all. Myself, Dr. Mohammed Shafi. I am working as professor in the Department of Community Medicine and I am also member secretary of Institutional Ethics Committee. So today we have jointly organized the workshop or training program in good clinical practice and the ethics in biomedical research. So today's first topic is about the historical perspectives and milestones in biomedical ethics. So before we start the historical perspectives and milestones in the development of ethical guidelines in biomedical research, I would like to just know from the audience that what do you mean by bioethics? Bioethics. Bioethics मतलब क्या होता है? Ethics in general, you can say, what is ethics? Anybody has any idea about this?
It's a set of principles which you have to follow, and it is laid down by the society or a governing body.
Okay, yes. So it is a set of principles. We have one topic for principles of ethics. So what exactly ethics means? उसमें हम क्या देखते हैं? What we see and what we actually do in case of bioethics. And we doctors or medicos are first involved in dealing the patients, and second, now the MCI and NMC is forcing much on research. So we are now into the research and doing, whether it is a mandatory research or it is optional research, we are doing. And in that we need to follow certain ethical guidelines which are usually laid down by various agencies time to time. Yeah. So historical, today in this session we have to see about the historical milestones, how the ethical guidelines they have developed. So before we go into detail, what do you mean by bioethics? So one is set of principles. Any other और कुछ इसमें bioethics में anything else which we see or we do in case of ethics or bioethics? Professional conduct. Okay. Or anything which is related with, किससे related है ये? How it is related? To what it is related? When you see a patient, first milestone in this lecture is Hippocratic Oath. I hope that you remember about the Hippocratic Oath. So what is given in that oath and what we take as a oath when we become medicos, the head of the institute administers the Hippocratic Oath. In that we swear that I will do so and so things, I will not do so and so things. So what are those things which we do and what are those things which we are not supposed to do? Any idea about Hippocratic Oath? Hippocratic, do not, yes, do not harm, yes, this is very important. Do not harm. ये आपको आज पूरा दिन भर याद रखना है. Do not harm your study subjects or do not harm your patients. Benefit and harm. Benefit and harm. These are the two things. So first thing that you should not harm, there should always be a benefit in. So biomedical ethics is the rational reflection on what is right and what is wrong. भाई आप कोई चीज कर रहे हैं तो वो सही है या गलत है. Suppose you are prescribing a medication to a patient. Suppose a patient comes to psychiatric department and the psychiatrist is prescribing a drug. You have to think that whether I am doing it right or wrong. Hippocratic Oath says that whatever best treatment is possible, you should give. So when you prescribe a particular drug, that time you have to think about that what right you are doing, what wrong you are doing. Okay. So ethics is about right, wrong, what is right, what is wrong, what is just, what is unjust, what is good, and what is bad. So there are two parts of a balance, and you have to see that benefits are more or harm is more, and in that direction you have to think, and it is in terms of human behavior. So ethics is related with the human behavior. This is just the milestones. Now what was known when these ethical guidelines were evolved, only one thing was there, that was Hippocratic Oath, and we all also have taken that oath that we will do the duties and responsibilities of physician, duties of physician to their patients in consultation to each other, public or paramedical profession, unethical act, misconduct related to medical practice, and the penalty action if above are breached. So these are the some highlights of the Hippocratic Oath. Ethics is not definable. You cannot exactly define what is ethics. It is not implementable completely. It is not conscious. It involves not only our thinking but also feeling. So with the feeling, you have to work in the clinical care as well as in the research. So ethics are the moral values of human behavior. So it is related with the morality. Ethics is related with the morality. So these are the moral values of human behavior and the principles which govern these values. So we have a separate session on principles of ethics. Every profession is bound by code of ethics. This word ethics is a Greek word. It is derived from the ethos, which means custom or character, and the essence of medicine as a moral community dates back to Hippocratic. So first milestone in the development of ethics is the Hippocratic Oath. So this oath was guide for the physician or professional ethics, and it says that beneficial treatment should be given to the patient. Refrain from causing harm or hurt to his or her patient. So you are not supposed to cause any harm. Would place the interest of their patients above their own interest. यानी हमको पेशेंट को पहले प्रेफरेंस देना है, बाद में हमारी इंटरेस्ट को देना है, ठीक है? So these are the situation becomes challenging for a doctor when he assumes the role of researcher. Now why we are sitting over here, because we are researcher. The doctor researcher has to serve both the roles at a time. The zeal of investigator has the potential to cloud the morality of the physician inside. So we should always be following good morals. History has been stored. There are so many instances, so many stories are available in the history. So it was realized that code of ethics for clinical research was needed and good clinical practice guidelines for human research were framed. In clinical practice, doctors place to treat every individual equally irrespective of so many factors. When it comes to research, the pledge is blurred at times. There are certain benefits involved. So in that case, the researcher does not follow ethical guidelines. So this image of treating each participant equally is blurred. And it is forgotten that a subject for research is also a patient. So you should not harm a patient who has put his or her faith in the doctor for his treatment. So here, if you are causing harm to the patient, it means that you are breaching the faith of the patient. The statement of first century physician from Egypt. Now this Celsius reflects the attitude of doctor turned researcher who justified experiments on condemned criminals by saying, he said that आप criminals हैं, उनके ऊपर किसी भी टाइप का experiment कर सकते हैं, whether it is causing harm or to them. So it is not cruel to inflict on a few criminals suffering which may benefit multitudes of innocent people through all the centuries. So what is your opinion about this statement in relation to the ethical guidelines or ethics? आपको क्या लगता है इसके बारे में? Whether he is ethically correct or incorrect? Criminals है, बीमार है, तो उनके साथ कुछ भी करो चलता है क्या? No. So it is totally unethical statement. But by making this statement, the researcher has taken for granted that they are given the liberty of being reckless. Because criminals can be sacrificed, such as guinea pigs are sacrificed in the laboratory. So this is totally unethical. So after that, it is very important to realize that exploiting the faith of the patients is an offense that is equal to crime. So if you are breaching the faith and doing harm to the patient, that is near to the crime. So this is another phase of research. So some researchers, they have caused harm to the study participants, and there are certain researchers who have performed experiments on themselves or their family members. Now this Nobel laureate Gerhard Dogmite discovered prontosil sodium sulfonate and first tested it on his own daughter, 6-year daughter, and had contracted a severe septal infection from an unauthorized disease. So he tested in the family member. Then John Joe swallowed 17 drugs in various doses to record their properties are only two among many such. So there are so many instances, और Out of these are the two instances where they have performed the study on the family member or on themselves. Now, medical science is one discipline where advancement of knowledge is largely guided by research and humankind has benefited from many experiments. So we know that our medical field evolves with the research. Benefit and risk are the two faces of the coin. So you have to think about the benefit or the risk. If there is no loss, there is no gain. So you have to take some loss, but the risk loss is assumed by leaders or participants of research, and benefit gain is reaped by a population who did not have to bear that risk. So it is said that benefit and loss, these are perceived by the patients but not by the researcher, and they may differ person to person. The role of ethical guideline is to establish the balance between benefit and risk. So whenever you perform any study, you should balance between risk and benefit and to ensure all the participants gets fair treatment. Suppose you are performing a study on role of insulin. One group you are giving insulin, other group you are giving placebo. So it means that you are depriving that group of diabetes with the insulin. So you have to give some fair treatment to the all participants in a study. So it is exploristic. There can be disagreement among individuals about what is right and what is wrong, and even when they agree, the reasons can be different. So for one researcher, it can be a benefit, but for other, it can be a loss. Despite the differences, the fundamental ethical principles is in harmony with the basic human rights. United Nations have given the human rights, United Nations Declaration on Human Rights. So your fundamental basics or principles of ethics should coincide or correlate with the United Nations Universal Declaration of Human Rights. So what this right says, there is a right to life, right to freedom from discrimination, torture and criminal, inhuman or degrading treatment, freedom of opinion and expression, equal access to public services. You cannot deny the services to any group of people in one's country and into the medical care. Now, this is a first developmental milestone after World War II that Nazis, they started doing experiments on the war prisoners, and they have caused or they behaved in inhuman behavior, or they caused so much torture to the participants that led to the first guideline for researchers, that is called as Nuremberg Code. So this is the first development of the ethical guideline after the experiment by Nazis in the war prisoners. So after this, in this trial, World War II trial conducted on 23 Nazi doctors and scientists at Nuremberg for the murder of concentration camp inmates who were used as research subjects. So among 23, 15 were convicted, 7 were condemned to death by hanging, 8 received prison sentences from 10 years. So these doctors were punished for doing the experiments. The trial brought to the light the tortures that were condemned, and in 1947 the judgment culminated in the formation of codes to guide research on humans known as Nuremberg Code. So what this code says, there should be informed consent. From this point of history, the concept of informed consent started. So you need to take the informed consent, prior animal work, preclinical trials are must for any new drug, qualified scientists should be there, risk justification by anticipated benefits, avoidance of physical and mental suffering, death or disabling injury. So this code, Nuremberg Code, says about these points. And some researchers, they did not follow Nuremberg Code. There are two examples here: Willowbrook hepatitis study and Jewish chronic disease study. So in this hepatitis study, children were used, and in Jewish chronic disease study, very old or senior citizen people were used for as a study subjects. So what is unethical over here? Is there anything which is unethical in these two studies? There are two vulnerable populations are used. One is children and second is the very old people. So that is also unethical, and we need to follow ethical guidelines. We will select the vulnerable population in the community. So both studies used a vulnerable group of patients who could not take independent decisions. Then situation was highlighted in an article published in 1966 which described 22 such examples of research where there were controversies regarding the ethics and all were conducted by reputable researchers and published in major journals. So there was an article in New England Journal of Medicine by Breacher, which highlighted about various experiments being done and causing harm to the study subjects. So in view of the emerging situation, the World Medical Association General Assembly, they have taken the note of this article and developed a set of guidelines to safeguard the rights and well-being of subjects participating in clinical research, and that we call as the Declaration of Helsinki. So the Declaration of World Medical Association binds the physician with the words, "The health of my patient will be my first consideration." The International Code of Medical Ethics declares that a physician shall act in the patient's best interest when providing medical care. The declaration specifically defines that the duty of physicians who are involved in medical research is to promote and safeguard the health, well-being and the rights of the patient. So when we are performing the research, Zubair साहब, जब research करेंगे तो क्या करेंगे? We should think about the safeguard of the health, well-being and the rights of the patient. इसके बारे में हम सोचेंगे जब भी हम स्टडी करेंगे, है? In very shocking turn of events, unethical research conducted by United States Public Health Service, that is called Tuskegee syphilis study. In this study, what researchers they have done that they let the people suffer from syphilis, and in spite of having treatment available in the form of penicillin, the patients were denied the treatment, and that has resulted into so many casualties and complications. So here there almost 28 lives were lost, and there was permanent disability in 100 subjects. 40 wives were suffered from the syphilis, and that led to the 19 cases of congenital syphilis. So there was a lot of bawal on this study. So after this, international ethical guidelines for biomedical research involving subjects were evolved based on the Belmont report in 1979. So these are the international ethical guidelines for biomedical research, which particularly focuses on 3 principles of ethics. That is autonomy, beneficence and justice, that will be talked in detail in the next session. Then in India, ICMR. So seeing the development of guidelines on ethics, Indian Council of Medical Research, they have developed first time in 1980 the ethical guidelines, and they were revised again in 2000, then 2017. Now we have the CTROs 2019 also. So in India, these guidelines are given legal status by way of Schedule Y, drugs and cosmetic rules. So this rule was evolved, and under that, these ethical guidelines were made. So it is available on the website of ICMR. You can download and go through it. Then with the advent of multi-centric studies involving different countries, having a uniform GCP was felt need. So the International Conference on Harmonization, that is ICH, GCP, that is Good Climate Practice, was developed in 1996 in consideration of the current GCPs of the various countries. So they have studied the GCPs developed by various countries, and then International Conference on Harmonization, they have developed their own GCP, which we follow, and in India we have the Indian GCP based from the ICH GCP. So for that also we have another session. So this the pyramid shows the chronology of the developments in the history of ethical guidelines. Then this is last in brief about the various guidelines developed time to time. So this is all taken from one article only, that is Evolution of Ethics in Clinical Research and Ethics Committee. A very nice article given in Indian Journal of Dermatology. Now, first slide we were knowing about the Hippocratic Oath only. Now finally, what we have now, we have GCP with us, we have the ICMR guidelines with us, then we have Schedule Y also with us, then there are so many other codes. So this is all about the historical perspectives and milestones in the biomedical ethics. So if you have any doubt, you can ask question or we will proceed to next session. Thank you.
So, there was a person named Potter Stewart who said that ethics is knowing the difference between between what you have a right to do and what is right to do. So basically, we are going to guide you regarding what has to be done and what is right, basically. So we all know that research on human participants we are doing to develop knowledge that can improve health, increase the understanding of a disease, and most important, it should be ethically justified. However, you all know that any research, whatever we are doing, it has some inherent risks, some probabilities of harms, and it may cause some inconvenience to participants as well as the whole community. Therefore, first and foremost, you have to take into consideration the protection of your participants. So for that protection only, we have developed the principles, or you can say the guidelines for ethical research. We have four basic ethical principles. We have first autonomy, second is beneficence, then non-maleficence, and fourth one is justice. Now autonomy. Autonomy means auto is what? Self. So patient has complete freedom of making decisions regarding healthcare procedures. Means he has the right to choose or he has the right to deny. Then beneficence, as the word suggests, benefit. So this emphasizes that the procedure, whatever procedure we are doing on the patient, it has the intent of doing good for the patient involved. That means, in short, we are going to maximize the benefit. Then coming to the non-maleficence, that means we are not going to harm, do not harm. So this basically emphasizes that the procedure should not do any harm on the patient involved and on a society as a whole. Lastly, justice. Now justice means burdens and benefits, means the benefit as well as the harm of any treatment should be distributed equally among all groups of society. Means there should not be any discrimination on the basis of caste or their financial status. Means it should be distributed equally. Now these four basic principles are further explained, or you can say generalized into 12 general principles, which I will be covering in my presentation. So the first one is principle of essentiality. Now essential, the word essential means important. So what does that mean? It means this principle emphasizes that human experimentation or experimentation on human subjects should be undertaken only when it is absolutely essential. It is important. Like if you should also consider alternatives also, like some study can be done on a simulation software or it can be done on some animal experimentation. If that result is enough, you should not go for human experimentation. And plus, if you are going to do that, first of all, your protocol means what research you are going to do on humans, that should be scrutinized by the ethics committee, independent of the proposed research. Second is principle of voluntariness. Now what does that mean? Voluntary means, anybody, what is voluntariness or voluntary? Yes. Now what does that mean? First of all, it is your moral responsibility as a researcher to completely inform or fully apprise your subjects regarding the associated risks as well as benefits of the research. You have to be completely fair in telling them that this research has these risks, these are the benefits. Never hide the risks. Then they should be informed about the right to agree or not agree to participate in the research. They have complete autonomy, or you can say they have the right to decide whether I want to participate or whether I don't want to participate. And one more important, they can withdraw from the research at any time. It's not that once they have enrolled, they have to continue the research. At any moment, if they feel that the research is not benefiting them or for any reason, they have full.
IIMSR stand for. Okay. So previously, it was like an international conference on harmonization. But recently, in the year 2015, now this word conference